Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, COVID is rising all across the system, all across the spectrum.
Yeah.
Tell us what we're seeing about inpatients.
Yeah, well, a lot of patients are being diagnosed, and unfortunately, Erika, our inpatient volumes continue to climb. I think we reported 113 from this past weekend. That number was 118. That is our highest all time. If y'all remember, I think at our peak back in January, we were at 90. So 118. We've committed 5 patient care units. We have plenty of beds. Right now, it seems like to get patients out of the emergency room, not so many emergency room holds, although I will tell you, inpatients are waiting in the emergency room for a bed, but we are moving them in. We are accepting transfers from other health systems that may be feeling stretched. It's just really extreme. The number of positives that are coming are still very high, Erika.
Yes, and this has been just an ever-evolving, ever-changing response to this pandemic, especially here recently what we've done to this campus here on the corner of Patterson and Woodrow Wilson. Tell us about how that's had an impact.
It is. Again, 93% of the inpatients are unvaccinated. That's a fact. You can't dispute it. The unvaccinated seem to be catching COVID and are being hospitalized more than the vaccinated. As far as what's going on here is really about getting the community taken care of from a testing standpoint, and the infusion center is about getting people infused with this monoclonal antibody therapy, of which has worked out beautifully. But what we've effectively done is removed a lot of that work out of the ER, so the ER can take care of emergency room patients. So now our emergency room is still very busy, over 250 patients a day, but not so many with testing needs and/or the infusion needs. All of that's being pushed to this other site on campus. Very novel approach that has helped us free up capacity to take care of those patients that need to be seen in the emergency room. And the monoclonal antibody therapy, I'll just tell the viewing public, the 120 that we pushed yesterday, y'all remember, in the absence of that, some of these patients very well could have been hospitalized. So the monoclonal antibody therapy can help people stay out of the hospital, and I think it's been proven here. So 120 yesterday. Erika, 968 people came through this drive-through yesterday. This is busy, but this is nothing like it was yesterday. It was wrapped around the campus, and we were able to get those samples in, and we got them pushed out last night. And the positive rate for all of the samples we did through here, 968 at 1,600 throughout the system, was about 19%. Now, somebody says, is that up, is that high, or is that low? I'd say we don't know. It just moves around depending on who comes and gets tested. But very interesting activity going on around COVID right now. And I just ask the viewing public, be careful, do what's required, and most of all, if you haven't chosen to be vaccinated, become vaccinated. And hopefully you'll prevent some of this.
Absolutely, Mr. Dean, and we are continuing to expand services to meet the public where they are. So Saturday we will host another vaccination event right here on our main campus with the hopes of vaccinating over 750 probably people to come through. So if you have not received your vaccination, you do not have to have an appointment, but you can make one if you'd like to fill out some of that paperwork ahead of time. Any other news you want to share regarding COVID-19?
Well, vaccinations. The FDA has now fully approved the Pfizer vaccine. So, again, people worried that they had not approved it. Well, it's approved. So now we have an approved vaccine, for COVID-19. That should not be a reason anymore to not receive vaccination. Secondly, they are also suggesting that those that are immunocompromised receive a booster. So we're now administering the 3rd shot. I'd say take advantage of this drive-through vaccination line this Saturday, and/or call and schedule for your vaccination at your doctor's office or other locations, Smith Northview. But do get vaccinated. This is really a difficult conversation, Erika, and I just want to tell you for just a minute. If you look at what's going on carefully, you hear the hospitalizations, you hear about the number of people being tested. What you don't hear about as much is how many people are dying. Well, unfortunately, another statistic, 10% of all of our COVID-19 related deaths have happened in the month of August of this year. That is significant, y'all. And again, the vast majority of them, super majority of them, are unvaccinated. Get vaccinated. It's the right thing to do.
Yeah, it's definitely sad to see these numbers and see what we're going through. Kudos to our staff and all of our volunteers, everyone who's helped pull this off so that we can care for the community the best way that we absolutely can. But we do ask for the community's help in these situations, which is if you can get vaccinated, please consider it. And let's start to make an impact on this number, because our staff are working hard.
They are working hard. They're tired, but they're strong and they're doing all they can. But y'all, again, I trust that the community is going to do what's required to get our arms around this thing.
Yes, and a special shout out to Park Avenue United Methodist Church. They are going to host a Park and Pray event here tomorrow to kind of love on our staff. So that will be happening tomorrow around 6.
I think around 6 o'clock. Again, another show of community support. Come to the parking lot, blinkers on. Our spiritual leaders in the community are lifting us up, and we thank every one of you. We thank Park Avenue United Methodist Church for arranging this. Our staff needs it. Very challenging for all the reasons we've talked about today.
All right, well, thank you, Mr. Dean, for taking time today to help us share this important information with you all. Again, you can always go to our website or our social media accounts to get the latest and most up-to-date information regarding COVID-19. Thank you.
Thank you.